I know there's a lot we could cover there as far as mitigating maybe some of those issues, but one of the things that you mentioned is having an uninterested partner. And I remember I had the honor of working at your practice for a while and getting to shadow you. And one of the things you would talk to men about is if their partner was uninterested, their wives could possibly take bioidentical hormones. And I know we don't talk about that often, considering we're a prostate cancer channel, but I think it's an important fact. And I know a lot of women who take it, and they seem to have, it kind of helps prostate cancer patients from a caregiver's perspective because they're more interested in taking care of their mate, they have more energy. So can you talk about the benefits of bioidentical hormones and who would be eligible?
Yeah, so this sometimes comes up when men have low testosterone and now they're recovering, and in the course of conversation, they're concerned now that their libido is coming back, that their post-menopausal spouse has a low libido, something that goes along with being postmenopausal. Women lose their estrogen and testosterone after menopause, and we know these hormones drive libido. Women can take testosterone, and it does restore libido. It sounds a little daunting, but it can be a very attractive thing because testosterone can give you more energy, improve weight loss, help with concentration, and of course restore libido. And the doses that are used are much smaller than in men, and there are doctors that bill themselves as experts under the heading of bioidentical hormones. So people can just Google that and find an experienced practitioner in their area if they want to pursue that further. One other thing that could work for spouses is medicine, another antidepressant that can have the opposite effect. We talked about the Prozacs causing low libido, but there's one antidepressant called Wellbutrin, which has been used to help people quit smoking. It's been used to help people lose weight, and also in some cases can enhance libido. So that would be another thing to talk about if people are reluctant to pursue the testosterone or the bioidentical hormone idea.
So if somebody is on an antidepressant that's possibly causing libido loss, could they talk to their doctor about switching to Wellbutrin?
Absolutely. I think that it's a well-tolerated medication, and it is a prescription medicine, but it's prescribed very frequently as a mild antidepressant.
So going into prostate cancer patients who have received hormone therapy and have, had a loss of libido, what do you do to help them gain that back? I know there's a lot of talk about testosterone replacement therapy. What are your thoughts?
Right. So sometimes patients are shocked when we tell them that they might be able to take testosterone. We use testosterone blocking agents to cause cancer to regress and shrink. So people think of testosterone as feeding the cancer like gasoline would feed a fire. So it's a controversial topic. It's becoming less controversial. Studies have been done now showing that even men with prostate cancer, as long as they're carefully monitored, can take testosterone. We got on this line of thinking a long time ago because when intermittent hormone blockade came along 20 years ago, we realized that that's just allowing the testicles to bring testosterone back in men that had previously low testosterone levels from their hormone blockade. Now they're stopping, they're taking a holiday, and they're getting their natural testosterone back. What we found in aging men is that sometimes they wouldn't fully recover their testosterone if they've been on Lupron for 6, 12, 18 months. And that's when we started venturing into supplying enough testosterone to restore the levels to normal. So giving testosterone in men that have low testosterone is certainly a practical consideration as long as the type of prostate cancer permits its use. There are low-grade types which would be fine with. There are men that have hormone-sensitive disease that can take it on an intermittent basis. So there's expertise involved in selecting people. But in our practice, I'm sure we have well over 100 men that are taking testosterone in some form or another.
Besides testosterone, is there any other things that men can do as far as medications they can take or anything else that they can do in order to get that loss of libido back?
Yeah, I think it would be just correcting the other things. I think fitness, and then, of course, getting off antidepressants, dealing with life stresses in an effective way so that they don't burden people down. And then, of course, the real issue is that if they're struggling with issues of potency and men are doubting whether they're going to be able to get an erection, that's a huge issue, and that needs to be corrected as well.
Thanks for watching. If you would like more information, you can visit our website at pcri.org. Also, subscribe to our YouTube channel. We come out with new prostate cancer videos every week.